Mark Chenoweth is an independent aesthetics consultant and regenerative medicine strategist, helping medical spas and wellness clinics bring next generation biotherapeutics like peptides and energy based devices into their practices. Through his platform at Aesthetic Pro Florida, he trains clinicians nationwide on science driven regenerative solutions that improve patient outcomes, boost profitability, and elevate the overall patient experience. Dr. Michael Heke, a PhD veteran in stem cell and regenerative medicine leader, has over 20 plus years spanning pharma, academic research, clinical translation, and biotech entrepreneurships. Dr. Heke reigned at the Rockefeller University and later served in a senior role at Stanford University. He has led major multi-center clinical trials, coordinated large-scale EU research consortia, and co-founded multiple startups. Today, he serves as an executive scientific and operational leadership role at the Crowley Center for Regenerative and Biotherapeutics, advocating and advancing best-in-class allogenic stem cell and exosome technologies for clinical, aesthetic, and therapeutic applications. Welcome to Glow Up and Get Real. I'm the Sweetface Injector, and today we have Dr. Heke and Mark Chenoweth, and they are going to speak about exosomes, PRP, Wharton's jelly, you name it. So let's get to it. Can you both share your journey into the field of regenerative medicine and what inspired you to pursue this path?
Yeah, maybe I can start. So I did my PhD in stem cell biology. And I started in stem cell research over 25 years ago. And back then it was still a little bit controversial and it was a big deal, but it was obviously coming with great potential and possibilities. And I soon became fascinated by the clinical translation of research into medical applications. So that's what I focused on, learning as much as I could in the field of basic research, but then seeing how that could fit into the real world with all its potential and promise. And it is over 20 years ago that I actually started and became part of the first clinical trials of stem cell therapy in then patients suffering from heart failure. And that was quite successful. Um, and that was utilizing the patient's own stem cells derived from their bone marrow, and that worked quite well. But obviously, all those patients were a little bit on the older side, had comorbidities. So you basically had to work with what you got. And it was always a dream to have an off-the-shelf solution for stem cell therapy. And that's where we are now. And that's why I joined the company that I'm currently the CSO for. We established such an off-the-shelf solution for stem cell therapy, manufacturing them from the youngest stem cells you can get your hands on, the Wharton's jelly of the umbilical cord. And they are immune privileged and they are very potent. Their job is regeneration and repair. And they have just finished building a new human, a healthy baby. And we harness this potential and this ability and capacity towards other fields in aesthetics and cosmetics as well to achieve rejuvenation. And we have seen fascinating results by it. Back then, we thought stem cells would be the ones doing it all, but it turned out that it's actually mostly through exosomes. So exosomes are tiny little bubbles that get secreted by those stem cells, and they communicate between cells. And there are tiny little packages that contain all the building blocks and the genetic information or for a cell, how to fix itself and how to reprogram and even rejuvenate and return to a more youthful state. So this journey started back in the controversial days of stem cell therapy through an overwhelming body of evidence that things actually do work. And exosomes are the new evolutionary step in stem cell therapy that we can utilize not only to address medical issues, but also to rejuvenate eventually.
Mm-hmm. What about you, Mark? How'd you get involved?
Yeah, so mine's probably a little bit different, probably less scientific back, but mine's more of being on the consultant and sales side of things and calling on med spas and dermatology and plastic surgeons, wellness centers. And it was probably, I don't know, 7 or almost 10 years ago now that it all started with, I think the first initial introduction to regenerative treatments into the aesthetic world was like PRP. If you remember back to like the vampire facial and how Kim Kardashian kind of made that famous. And so, at the time we were selling like lasers and microneedling pen had just came out. So we were all pretty intrigued, but kind of confused at what this new, platelet rich plasma was and how it was generated. Um, so then as we got into that, I started, I did pick up a PRP line and had some experience with that. And I got to see firsthand how regenerative treatments kind of really boosted the results of treatments. And then I was introduced shortly after that to the exosomes, and I really felt like, everyone thought stem cell therapy was kind of only for the rich and famous, and that eventually maybe that would become affordable for the common, patient that comes to a med spa. But exosomes were kind of that key that, like Dr. Heke says, the stem cell is obviously the workhorse, but the exosomes or actually, I'm sure the exosomes are the workhorse of the stem cell. So all the messages and things that the stem cell wants to communicate to those injured cells is all part of this little tiny nanoparticle messenger, and it releases everything. So I was intrigued by that. It was affordable for med spas, affordable for the patients who wanted to really boost their results and build collagen and build elastin. So it kind of just spurred on from that, and exosomes have really become, a staple product and solution in most aesthetic practices.
Right. But not all exosomes are the same, is that correct? Or
Yes.
how they're stored or
Oh yeah.
packaged, and
Yes,
can you
They,
explain
they are
that?
huge different. There are huge differences.
Okay.
Um, PRP is a nice keyword because PRP also paved the way a little bit. It's another proof of concept that how growth factors actually do work and do something. And exosomes are just way more potent than PRP because the PRP is known to have anything between 5 and 15 growth factors, maybe. And exosomes, if they're sourced properly, they have the whole panel of 50 known growth factors and also a bunch of cytokines and microRNAs that constitute the genetic information to reprogram the cell. So, as I said, all the building blocks and the genetic information, the instructions, how to do things and how to rejuvenate and repair. However, these exosomes, they are tiny little lipid bubbles. And for instance, if you lyophilize them, which is often done in order to preserve them, supposedly, and make them shelf stable. But if you do that in the process of lyophilization, these bubbles burst. And the reason why that is important is that when you do that, you have a shelf stable product, which is great. You can ship it at room temperature rather than on dry ice or blue ice, which is also good. But when those bubbles burst, you might still have some growth factors and so on around that survive the process, but they can no longer function as bioactive entities. So the way an exosome works is it fuses with a target cell, then introduces all its cargo, which is comprised, as I said, of growth factors, cytokines, chemokines, and other functional proteins, metabolites, lipids, and microRNAs. Um, and that's how they actually function. If you don't have a bioactive and intact exosome, then you only have those growth factors and they might elicit a biological response. That's also beneficial, but then it's only transient and superficial. I always liken it to, let's say you have dry skin and you put on a moisturizer. If you do that, your skin looks nice and supple and everything is fine. But if you take away the moisturizer, you are back to your dry skin because the actual problem is not fixed. And that's why exosomes are so special. They are actually able to fix the problem so that you go from dry skin to normal skin again, and that it's fixed and repaired. If you don't have an intact exosome, then you only have like a superficial and transient or temporary effect, but the fixing cannot be done. So that's the one big difference. The other difference is like the cell source. We usually derive our exosomes from mesenchymal stem cells, and there are various sources like bone marrow, adipose tissue, and perinatal tissues. Perinatal tissues are by far the most potent ones because these are the youngest mesenchymal stem cells you can get your hands on, obviously. Adipose and bone marrow derived stem cells can also be utilized. They are a source, but they are suboptimal because they come from adult donors. And even if you're in your mid 20s, say, and you're healthy and you're in the peak of your life, so to say, but you still have been subjected to 20 plus years of environmental stress and hazards, chemicals, toxins, bad food, smoking, radiation, disease, and aging. So you might even have accrued some mutations over the course of your lifespan already. And that's why they are less potent and also on some level less safe, and therefore a suboptimal choice for exosomes. And then finally, I know I'm already talking too much, but finally there's also salmon DNA out there and plant-derived exosomes, and that all sounds very good, especially for those that are concerned about anything that comes from another human. But the fact is, also as Mark said, they are cell-to-cell communicators, these exosomes. And just as we cannot talk to animals or plants, these cannot talk back to us. So the signal transduction and the communication is less efficient or not even possible. So they don't match up with human-derived stem cells and stem cell-derived exosomes. And that's why perinatal tissue derived exosomes are the most outstanding ones. And that's also why you should never use lyophilized products.
So, Mark, yeah, tell us about your side.
Yeah, if I can just add on the sales side of things, obviously over the last probably 7 to 8 years, we've seen the market really get crowded with other exosome companies and products. And I guess from a provider standpoint, you just got to be careful on what's out there. There's a lot of smoke and mirrors, a lot of marketing. They get excited about it because they think they have exosomes, but there's scientific ways to get these exosomes from the stem cells, and it's important to know how they're manufactured, what's in it, how effective are they, and obviously being affordable and things like that. So there's just, I did a lot of research and really feel like these age zero exosomes give you all the proof. You can pick up any box of your competitor or competing exosomes, and some of them will have like stem cell conditioned media or any kind of like anything that's not specifically saying that it's an exosome. You got to really kind of question that and be like, what's really in this? And is it really just a lot of debris that has some growth factors and maybe some proteins or peptides that's kind of doing the work of the product? But to kind of echo the whole concern about a lyophilized exosome, I like the analogy that actually Amy, or not, that Erin had sent to me that we talked to, that she said that you got to think of like a dehydrated strawberry. Like you can't just rehydrate a strawberry and it's back to its original form. And that's very much the same case with this very delicate bilipid layer that's on every exosome. If that gets damaged or you remove all the water from that, it's no longer an exosome. It's just, again, debris that's not going to be able to penetrate into these injured cells and communicate to that area. So yes, not all exosomes are created equal, and you have to be careful with what's out there.
Yeah, right. That's good to know. What does regenerative biotherapeutics mean to you? And how's it shaping the future of healthcare? I know, Doctor, you talked about using it with heart failure in the past. Tell us a little bit about that and what other diagnosis you think that exosomes can heal coming into the future.
Well, thank you for the question. I don't think there's actually a limit. What we are trying to figure out now is the best routes of application, the dosages, and the treatment frequencies that are required to get best results. So that is still a black box, but that things do work, we already know. We have like lots of case studies. You find tons of information in the literature. And it's just about optimizing, and that relates once to the most suitable products that are properly sourced and properly manufactured, of course. And Mark had a very good point there. There's like so much stuff out there, especially in the exosome business. And I have to say that probably 99% of all that's out there is really suboptimal, let's say, at best. There's a lot of false promises and claims, and it is obvious sometimes that we see the main effort goes into marketing, and with good marketing, you can basically sell everything. But it is important to inform yourself about the scientific foundation that a product is based on. If you ask tough questions, you will actually find some information and will be able to distinguish between a good product and a not so good product, or snake oil, which is also very rampant especially in the field of aesthetics and cosmetics. But if you talk about a disease and other conditions and apart from aging, we've seen stem cells being applied for years already for yeah, virtually everything you can think of. And now exosomes are on the forefront because they have certain advantages. They're like very, very tiny. So they do not cause what we sometimes see in mesenchymal stem cells being applied, where people suffer like a temporary raise in temperature, heart rate, or these kinds of things, headaches. Because the body, even though those stem cells are immune privileged and don't get rejected by a body, but the body actually realizes that something is coming in force into the body that wasn't there before. So there's obviously reactions. For exosomes, it's less the case because they are so tiny. And because they are so tiny and so abundant, if you manufacture them properly, you can employ them in very, very large numbers. In addition, they can cause cross the blood-brain barrier, which is very important and relevant for all things neurological and neurodegeneration. So we've seen them applied in Parkinson's and Alzheimer's, MS, with very promising first results. And as I said, it's a matter of finding out the perfect dosage and treatment frequency, which is also dependent on the individual patient, of course. But I don't see any limitation in their application towards virtually any condition you can think of. Some more potent than others, obviously, but things do work because everything that goes wrong is going hand in hand with inflammation, for instance, and inflammation can immediately be addressed by exosomes. In addition, they can fix things, so they can repair cells. And that is always a good thing, no matter what kind of condition or indication you suffer from.
Okay, great. Great.
I think it's really just, to kind of go back to your question of how it's shaping the future of healthcare. It's just,
Mhm.
it's a very exciting time. I think you would agree, Amy, is that, before we're out, even in just regular medicine, they're trying to treat diseases and things like that, where now patients are coming to med spas and wellness centers and they have access now to stem cells and exosomes and growth factors and peptides. So you can really, you know, help people feel better from the inside out. And so that's why I think we're just at the very beginning with exosomes have really opened it up to the general population. But I think the sky's the limit. Like we're really going to be able to repair and replace and regenerate versus just getting a prescription and taking a drug to try to mask things and try to help inflammation and continue. So pretty exciting times, I think.
Yeah, yeah.
It's really 21st century. It's somehow similar to AI. I mean, AI will change everything so dramatically, and it's also just at the beginning. And I think the same is true for exosomes. They're like so fundamentally and profoundly different in their way how to address certain problems, and makes it easier and fast and simple, and all of that based on like very straightforward notions. So it
Mhm.
is really exciting. I share that view with Mark entirely.
So, how do you address a concern by, say, a patient, a family member, a client that says, well, if you're giving me exosomes that
Mhm.
come from another human being and it's a cell messenger, how do I know it's not going to cause cancer
Mhm.
or increase maybe existing bad cells in my own body? How do you address that?
Very good question, and it's a very important one. So first of all, every concern in this regard should be taken very seriously, and we had those concerns too when we started manufacturing our stem cells and exosomes, because we want to be the beneficiaries of them as well when or if that is needed, and we want that for our loved ones as well. So again, it's very important to cautiously consider the original cell source that you opt for. It has to be pristine, and it has to be monitored. You need to know the medical history of the donors and so on. So all of these things are very important. As to the mode of action, how stem cells and exosomes work, exosomes in particular are always a function of their cellular origin. So they actually are messengers by a particular cell to do what the cell would normally do. So virtually all cells secrete exosomes. And if you take a tumor cells or cancer stem cell, they would also secrete exosomes, but these exosomes have the specific task to actually promote the tumor environment. That would be very concerning, and that's something we do not want to have. So again, it's very important to ask what source do you want to use, and that's why we came to focus on H0 exosomes and stem cells, because these exosomes or these stem cells had just built a human, a healthy new baby, and that was their job, to actually develop such a baby, to regenerate and fix things when they are needed. And there's another very interesting aspect about this H0 designation or capacity, and that is while we undergo development in utero before we are born, virtually anything that can go wrong during development can be fixed. So there was a very interesting and impressive experiment like ages ago, where they inflicted a cardiac infarction in rat embryos before they were born. And not surprisingly, what happens then, a lot of heart tissue goes down and will be replaced by scar tissue. And normally there's not much you can do about scar tissue. However, when you did this before the rats were born, then even the scar tissue got fully replaced by fully functional normal tissue again. So that's what we actually call H. Unfortunately, we lose that capacity as soon as we are born. So we still retain regeneration potential, of course, that again diminishes with age, but we do have the potential for regeneration. But that potential for absolute regeneration and total repair, that is unfortunately gone. But the stem cells that are sourced from that time, and these mesenchymal stem cells that we find in the umbilical cord, have been produced before the baby was born. So they do have that capacity, and that's what we want to harness. In order to do that, you actually have to limit your culture and expansion of those stem cells strictly to a very low passage number. So you cannot culture them indefinitely, or else these cells will change over time rather quickly. Spontaneous differentiation, could be even mutations over time, and contaminations. So we want to keep them pristine, and that's why we, for instance, we limit our passages to expand the cultures to 4 passages. That is commonly understood in the scientific community and also postulated by the International Society of Stem Cell Research to be the limit. After 4 passages, we can be reasonably sure that 99.99% of all cells are identical with the ones we just harvest. Low passage numbers is very important. The right cell source is very important. Then I mentioned we utilize Wharton's jelly. Wharton's jelly is the gelatinous substance or tissue in the umbilical cord that makes it like crunchy and sturdy. But there are other perinatal sources like placenta, umbilical cord blood, amniotic fluid, and so on. They're also good, okay, but they are not as good as the Wharton's jelly. So even among the perinatal tissues, Wharton's jelly is by far the best. And one of those reasons is that the stem cells in the Wharton's jelly are even protected by maternal contamination. So you won't find any vaccine residues in there, which is a concern for some people. You don't find any DNA in there, which would potentially cause replication and so on. So here we go. Wharton's jelly, H0 stem cells are the most pristine ones. They are the youngest ones. They are the most potent ones. They do not carry the DNA. They are not able to replicate. They are acellular. They are not living entities, so they cannot change anything. And the way it works is like they can only do good, right? By their designation and by their cellular origin. So if damaged cells take them up, they will get fixed and return to a more youthful state. And bad cells, or like if you happen to have a tumor or something, they cannot utilize them in a way, if that makes sense. So there's really virtually no concern whatsoever that they could either cause or promote cancer. And the concern, especially with cancer, relates to something much older, when it was found that pluripotent stem cells, like embryonic stem cells and iPS cells, occasionally cause teratomas, which are benign tumors. Just because they are so potent, that they're hard to control. We don't want that. That's why you're using mesenchymal stem cells. They're only multipotent. They can virtually do anything we want them to without causing these kinds of problems.
Okay. Interesting.
Yeah. And I obviously did a great job of explaining it. I don't know if I can add much more, but on the layman's terms, it's good to have the scientific version and then the business side or the sales side or consultant side. But when I meet with providers and patients, I typically just explain to them that there's really no risk there because like Mike mentioned, they are completely acellular, which means to explain that is there's no cells in them. Something doesn't have a cell, it can't transfer anything from the donor patient to the end user. So it's always 100% very safe and effective. So hopefully that helps it.
Yeah, you explained it very well. Thank you so much because I've heard different scenarios of why exosomes are so great, but I mean, you told us scientifically why, and I really appreciate that. So I can explain that now to my patients easier. So I appreciate that so much. What are some misconceptions about regenerative medicine that you'd like to address?
Well, we talked about some of them being that all peptides are created the same.
Yeah.
Obviously we've gone into that, but I think people think that it's going to be a quick fix. I think that we're very quick on saying they're used to Botox that's going to set in 24 hours. Regenerative medicine takes time. I think it's a biology, so we know that collagen takes about 8 to 12 weeks to develop. The two biggest benefits that I think that exosomes bring, besides cutting the inflammation down, cutting the downtime in half on most of these procedures, is that you're really boosting the collagen. And there's been studies that collagen and elastin, and there's been studies that show like a 600% increase in collagen production when you add exosomes. But again, it's not overnight. So they're just going to slowly, patients are going to see that their skin starts to feel better, it starts to look better. But that's one, I guess, misconception, is that they think they're going to throw some exosomes or stem cells or PRP on, and then instantly, I think the instant rate gratification is they see that redness has gone down, but really the main regenerative side of it hasn't even kicked in yet. So I think that's one of them. I don't know if Mike has another one.
No, that's a very good point. And if you compare it to other things like peptides, vitamins, and all these kinds of things, they are good, or individual growth factors. PDGF is like, hyped beyond belief. And they're all good things, but they're just like one particular aspect of a whole complex system. You also have to imagine that our body is constituted in each cell of like roughly 20,000 genes, and they're all expressed at a certain level. And you can imagine that if you throw in like one growth factor or one peptide or even like a handful, they do something, yes, because they are relevant, but they can only do so much. And as it always is in regenerative medicine, or most of the time, it's mostly symptomatic treatments. So it's palliative. They give you a temporary fix, improvement, but it won't last. And exosomes or stem cells are the only means by which you can actually fix things. And it's a good point that Mark said, like it might actually take some time. So if you aged like we all have for a few decades, now us being in the 30s, we don't look like being in the 20s anymore. If you want to return to a more youthful look and so on, it takes a couple of applications. And we have seen that we did 100-person clinical trial for skin rejuvenation with our exosomes after microneedling, and we had very good results. But it was also apparent that people on the younger side, in their mid-30s, low to mid-30s, seemed to benefit more from it. So they had a more visual impact of the 3 treatments that were given, as opposed to those people that were a little bit advanced in age, in their 60s. And that obviously makes sense, because if you are a weathered 60-plus-year-old, it takes more time, to shave off than for somebody in their early 30s. So it all makes sense. It will take time. And then, of course, age keeps progressing, right? We cannot prevent aging per se, but we can slow it down, and we can alleviate certain, downsides of aging. And that's why we maintain these kinds of regimen over time to make sure that we do the best we can. Similar to working out, you have to work out, and at advanced age, you actually have to work out a little bit more, even though it hurts a little more.
That's right.
Like in
That's
that
right.
Sure.
That's right. Well, how do you see the relationship between exosomes and aesthetics medicine evolving in the next 5 years? I know right now it's really big to have exosomes in a skincare product like a cream or a lotion. And as you discussed earlier, those are not very therapeutic.
Mhm.
So if you were to inject the exosome, say in the face, opposed to applying it, do you see that in the future or is that being done now?
Both. I see that in the future as the most promising approach. Everything topical is doing fine, but it's the cosmetics aesthetics industry, and you get away with a lot of stuff. That's why you have so many exosome providers. If you think about it, regenerative medicine wise, then the hurdles are much higher. You can apply those. There's the right to try, the compassionate use, and there's a mechanism allowed by the FDA is called expanded access and so on. So you have various means to actually employ both stem cells and exosomes for medical applications today. But most physicians are not very familiar with it, or they're a little bit concerned about their malpractice insurances, or the FDA hasn't specifically approved things. And it cannot be done quickly because the reason why the FDA stalls on both stem cells and exosomes is that it is hard to normalize things. You have to afford batch to batch consistency. That means like your manufacturing standards have to be extremely high to provide a good product. And it's not rocket science, but it's really tedious and diligent work you have to do. And because most providers cannot or don't want to do that, your products out there are so. And that, of course, makes the FDA very wary. Arguably, there's big pharma who's less interested in this entering the market because they do not want to fix things. They want to treat people because that's where the money is. So it goes all over the place. But coming back to your question, injection, we also work on this because sometimes it's like this, I don't want to say gray zone, but there's this overlap between an aesthetic application and a medical application. To give you an example, we successfully treated scars. So scar prevention is one thing, and even scar reversal is possible. And then it's a very interesting thing. If you say, I want to improve the appearance of a scar, then it's aesthetic application and you can do it. If you say, I want to treat a scar, then it's medical application. Even if what you're doing is the same thing, it would be just by the wording, it would be different. Or if you take microneedling, if you do a microneedling first and then exosomes, it's aesthetics. If you were to put on the exosomes first and then microneedle over it, it would become medical application. So it's a little bit absurd at times, but those are the things that we have to observe. That's, by the way, why we have two companies. Regenerative is the parent company who manufactures everything according to FDA guidelines, has a New York State tissue bank license, which is one of the hardest to get, CGMP, and everything is done in clean rooms and so on to provide a medical grade product. And this product is also utilized by our cosmetics that is Risolier. So it's virtually the same product. Everything is medical grade. So for cosmetics, it's arguably an overkill, but we believe in it because if you do microneedling on your face, you have like an open wound. So whatever you want to put on there better be medical grade, ideally. So we believe in that. And it would be also okay to inject it. But if you want to inject it today, it has to be Regeneral. If you only apply it topically, it can be Risolier. It's just regulatory wise, these are things that are necessary in place. But yes, I mean, obviously, when you inject, we have seen that in hair restoration, for instance, that microneedling plus exosome is very effective. If you inject it, it seems to be somewhat more effective, and you might need lower dosages, which makes it more affordable. And then you just have to live with the downside of a more invasive procedure, maybe. But there's a variety of things how you can team it up with adjunct therapies like CO2 guns and all the things that are out there that you can combine with exosomes with no need to really inject. But it will come, and it will be very exciting. Um, I'll put-
Yeah. Well, you brought up hair restoration.
Mhm.
There's a lot of medical spas that are doing this now.
Mhm.
One of the methods is to apply it to the scalp and then push it through with ultrasound. Another
Mhm.
is to inject it straight. And then there's a third way of microneedling and applying it. One of my questions to you is, if you are injecting it, which is something that we do in our medical spa, what is the minimum, the smallest size needle that does not destroy the exosome? Because I know, like
Oh,
with PRP, we need to stay at 27 or above the
mhm.
gauge. Do you know what that would be?
There's no limits. The exosomes, and the reason why you do PRP is a little bit different because it's plasma that you also want to utilize. We actually, when you talk about hair restoration, we have seen amazing results. Not in the US, they actually, our people in Pakistan, there's like different regulatory frameworks there, and they can inject exosomes, even our topical ones, and they often combine it with PRP. And what happens then, the plasma in the PRP promotes like a fibrin mesh of sorts that keeps those exosomes in place. So it seems to be even more efficacious than exosomes alone. So the combination is great. When you inject it, you need lower dosages because you're more targeted. All the adjunct therapies we are aware of, which is any kind of abrasion really works. Microneedling in particular, because you have like these hundreds or thousands of microchannels that allow the exosomes to penetrate a little bit deeper into the skin. Same for those CO2 guns, they seem to be very effective. Although they might destroy part of the exosomes, we don't know. There's like things like Jubisonic. I'm not so familiar with all these adjunct therapies, but all of them work to one degree or another. And surprisingly well. You could even utilize exosomes just by itself, but then because they have the ability to actually penetrate the skin, just as it is by massaging them in. But any kind of abrasion or getting deeper into the tissue is definitely helpful to have better efficacy.
Okay.
Yeah,
All right.
and if I could just add a little bit, Amy, when I was selling PRP systems, I think a lot of the providers were just used to injecting PRP because the PRP molecules are so large. You have to get them down deep with
Yeah.
with the needle.
Mhm.
And then once exosomes kind of came to the surface and they realized how much more effective they are because they have way more growth factors in them than the age dependent effects that affect the PRP. We found that you know the micro channels on the microneedling pen are plenty large enough to get these nano-sized particles down to where they need to be. And
Mhm.
exosomes inherently are attracted to inflammation. So you just need to create that injury, that inflammation, and the exosomes find those hair follicles, wake them up. And I've found personally not personally because these follicles are dead, but working with my providers, we just saw better results with the exosomes and a much more comfortable treatment for patients that you really don't have to inject them anymore. You can just create that 0.5 millimeter to maybe zero 0.8 depth that is very tolerable. And you just make those injections with the pen and then topically apply the exosome. So it's been really a nice change for the hair restoration market for sure.
Okay. Now, I know it was discussed, doctor, that putting the exosomes in like a PRP plasma base,
Mhm.
it might increase and be more beneficial. Would this also be beneficial in applying topically or
Um,
straight exos?
Probably not. If you go
Yeah,
just topically, you basically don't need PRP because you need it like if you're like deeper into the tissue, then it's very
hmm,
beneficial. But for topical application, exosomes will do. And
just straight.
PRP, the one downside of PRP, it's also somewhat invasive. Now it's a blood draw. You have to do the procedure to actually get your PRP, and then you have what you have, and you never know what's inside really.
Right.
So it's completely a black box.
Right.
Our platelets are inflammatory. When you put PRP on someone's,
Yeah.
you see them light up, where exosomes are that anti-inflammatory response. So it's the total opposite, much more effective product with exosomes,
Mhm.
I think,
Right.
personally.
And Mark had a good point. Like microneedling is the most prominent candidate. So we inflict micro damage and microinflammation. That's why you all read. And that triggers, of course, endogenous repair mechanisms. So the skin tries to repair the problem, and then you provide those exosomes, and they are happily taken up with great appreciation to support this repair mechanism and amplify it
Hmm.
dramatically. So that's
Exactly.
why it works so well.
Yeah. Yeah. But what about nebulizing exosomes? Tell me a little bit about that.
Yeah, it's often done for at-home care that you have a little nebulizer or atomizer. Do you need for like skin or for inhaling?
Inhaling.
Inhaling. also done. If you have any condition that's like pulmonary with your lungs or so, then nebulizing is a go-to. My mom is suffering from COPD, and she's fairly advanced stage. I mean, nowadays she's end stage. And we tried the nebulizer and exosomes, and at first it was not very effective. We tried 100 billion, and then we realized we have to go up. 250 billion actually helped her dramatically. COPD is a progressive disease. You cannot reverse anything about it. It will only get worse. It will never get better. And yet, when she underwent these nebulizing treatments, her lung function improved from 30% to 40%. And her doctor was flabbergasted. I was wondering what she did, how she could possibly improve. And same like all these like symptomatic things like the deep chested mucus that can never really come up, all of that cleared out. So she had a dramatic improvement.
Wow.
If it can be reversed, that's a different story. It's really about like the frequency of treatments,
Mm-hmm.
dosages and so on. So it's very tricky.
Mm-hmm.
But it does work. So for everything pulmonary, I would advise nebulizing. And then for everything neurological, cognitive function and so on, you should use a nasal spray. We have seen simple nasal spray application having major effects on a baby with cerebral palsy. So she was just getting nasal spray 3 times a day, and she started being alert and responding to her parents. She was at some point able to stand and take steps and so on. It was unbelievable. And also utilize it towards like various conditions now, in MS, ALS, and all these neurodegenerative diseases, Parkinson's. And if you combine that with regular IV therapies, then it's the best of all worlds. We are currently entertaining or in preparation of a large clinical trial with NFL players, former NFL players, to address all these downsides, the effects from countless concussions they had to go through. And it's very exciting to see what the outcomes are.
Yeah, that is exciting.
Mm.
That is really, I can just think of all my friends and my family and my
Yeah.
patients that would benefit from exosomes nasally
Oh, yeah.
and
Basically
inhalation.
everybody. So you don't have to wait until you have any condition. If you have like a nasal spray bottle at home, like you utilize like 1, 2, 3 times a day, it will definitely do something for you.
So if you were just to receive the H0,
Mhm.
it comes in a 5 ml and you put that in a nasal spray, but how long can it sit in the refrigerator?
We have seen it stable for over a year. So
In the
it's,
fridge?
oh yeah. So
Wow.
we typically don't advertise it because as a manufacturer, you want to err on the side of caution. So we typically give out different expiration dates. We know for sure that we have tested our exosomes um, after staying in a fridge for over a year, and they were perfectly fine. There was no degradation in terms of integrity or bioactivity. We have even seen it like over 30 days at room temperature without any loss, apparent loss. So
Wow.
they're supremely stable. They are delicate, as Mark pointed out, in one regard, whenever it comes to lyophilization, for instance, but they are not as delicate as if they would immediately be destroyed or go bad when you keep them in the fridge rather than in a freezer or even at room temperature. It's nothing that we would recommend. It's always, if you get those exosomes, keep them in the freezer until you're ready to use them. If you started using them, keep them in the fridge. Or if you have like your nasal spray at home, for instance, then of course you keep them in the fridge and not in the freezer. You don't want to thaw them all the time. And for as
Right.
long as you avoid repeated freeze thaw
Oh, yeah.
cycles. And I even find when we ship them on dry ice, when a package gets delayed and they started thawing or have been thawed, for as long as they have not been subjected to temperatures above 140 degrees Fahrenheit, they're still fine to be used. Just put them back in a fridge or freeze them again if you want to use them for longer storage. Then they're fine. So extremely stable.
Good. Oh, wow. Good to know that. Great. Well, one last question. What is your sweetest tip of the day?
That is an
I-
unexpected.
Right? I ask everyone
Yeah.
that comes
Well,
on.
if you want to use exosomes, first of all, ask critical questions. Don't settle for anything that is just like making wild claims and promises. Look a little bit behind the scene. I mean, that is not so sweet a tip, because it's more like be prudent, ask tough questions. Always ask for a product that comes with a certificate of conformance, that you actually see how it's manufactured, that third-party testing is done. Or for a pristine product. Ours, for instance, come just in saline, physiological saline. There's nothing else in there, only exosomes and saline. That's, by the way, why they are so stable, because we do not have any contaminations. There's nothing, it's aseptic, sterile, so nothing can happen to them. So that is very important. As for nanoparticle analysis, to see that it's really what's supposed to be in there. As for electron microscopy pictures that show that you have an intact exosome. And then you can be reasonably sure that you actually have a good product. And other than that, I would advise it's coming up. It's certainly a revolution of what we can do. Start using them early, start using them often. And I guarantee you will be aging better. You might even return a few with the clock, a few full years, and then we will find out what the potential, what the limits are.
Mm-hmm.
And
Mark, do you
Amy,
have a tip?
and you'll like my tip because it's short and sweet. But do you know what the cheapest collagen stimulator is on the market? It's to smile. So if you
Aw,
smile, you'll stimulate collagen, and that's the way to go. So that's my sweet tip of the day.
I like it. I
All
like
right.
that a lot.
Very cool.
Well, how can the listeners get a hold of you? No
For
phone
me,
numbers.
yeah, no phone numbers. For me, you can reach probably the best way is on Instagram. I'm at Aesthetic Pro Florida, or the abbreviation FL, Aesthetic Pro FL. And then obviously you want my email? I can do email. It's
Sure. And
Mark.
I can put it in the
Okay, perfect. Yeah, if you put
link.
in the link, that'd be great.
Yep. And what about you, Doctor?
Yeah, I could refer you to my company websites or so, but both Regenerative and Resilier in particular are a mouthful, and you probably
All
will
right.
be able to figure out how exactly they are spelled. So look for myself on LinkedIn. Michael Heke is my name, Heke. It's a 4-letter word, easy to remember, not to be confused with Hickey. If you want to make fun of me, that works too. Or contact Amy, and we'll be in touch.